If you have any idea how many times I've tried to do this video, you would laugh. I don't know how video bloggers do it without making 2 or 3 or 4 or 5 videos. It's crazy. Anyway, so I'm just going to start this and I'm just going to do this video, and what it is what it is. Alright, I started a blog just a few days ago called A Positive Notion through Facebook, and I've had some of my friends that have asked me to tell them a little bit more about my cancer. And I also have some friends that have asked me to do a video because they've actually never met me and never saw me in person. And never heard my voice even, because we are cancer patients that are spread all across the world. So I'm going to give a rundown as much as I can of my cancer and my little journey without boring you to death. I'm going to really try not to bore you to death. So, anyway, my name's Carmen. And in 1986, I was 14 years old. And I had a lot of pain in my ear. I was an avid swimmer. It was close to the end of summer, and my mom took me to the ear, nose, and throat doctor that had put tubes in my ears shortly after my adoption. My aunt and uncle adopted me. He told me that I had air behind my ears and that I needed to stop sniffing, and I probably had swimmer's ear, and it just, turned into air behind the ears, pressure behind my ears, and if I would stop sniffing and I would blow my nose, that I would be much less likely to have the pain. It didn't help. But from the age of 14 to the age of 27, I saw a total of 10 doctors. I was diagnosed with temporomandibular jaw disorder. If you don't know what that is, you can look it up. It involves a lot of headgear and things to keep you from grinding your teeth because they think that that's where it starts. I was diagnosed with chronic ear infections, and I was diagnosed with being a hypochondriac. I was told that there was nothing wrong with me, that they couldn't see anything in my ear. Obviously, nothing was there, that I was obsessing about it, and I just needed to stop. It got to a point where my cheeks hurt, all this area here and here hurt, and I would do things like pull on my hair. I had really long hair at the time. I'd pull at my hair. And what it was relieving the pressure. So if I pulled, then the pressure would lessen, and it helped for whatever reason. Well, I understand now why it did. There was tumors there, but I would pull on my scalp and relieve some of the pressure. I would also do things like bang my head against the wall like I was going crazy. I really felt like I was going crazy because nobody had listened to me. In 2000, I was 27 years old. And I had an eardrum that burst. My left eardrum burst while I was at work. I was working at Head Start. I ended up at urgent care. From urgent care, I ended up with a local ENT, ear, nose, and throat doctor. He did 2 biopsy surgeries and found out that I had a rare cancer called ceruminous gland adenoid carcinoma, which actually is also ceruminous adenoid cystic carcinoma, which is the primary cancer that I have. I have ACC, adenoid cystic carcinoma. From his biopsies, I was referred, my insurance required a referral, and I was referred to Dr. Larry and Dr. Kent McIntyre in Joplin, Missouri, with Freeman Health Systems, and they were wonderful. They did 16 hours of surgery and found that I had tumors in my parotid, my submandibular. They actually did a surgery where they cut here and then they pulled everything over, and then they found the parotid and the submandibular tumor. And they found some tumor in my scalp, and they found that I had the tumor in my ear. I ended up going back after those 16 hours. I was in ICU, and then had to go back, and they took out 3 tumors in my neck. And then I did IMRT radiation. I was told that they felt like they got clean margins, and so they wanted to do the least amount of radiation that they needed to do. It was really just a precaution. I had a total, by that time, of 30 hours of surgery. So, because I had the biopsies, plus the 16-hour surgery, plus the 8-hour surgery, and anyway. So, I had IMRT radiation, I had low-dose radiation, 37 treatments. From there, I really felt pretty good for about 10 years. I had scans, I had CTs and MRIs, but after 10 years, they really didn't want to do them as much because they felt like it wasn't necessary. If my cancer hadn't come back, the likelihood of it coming back wasn't really there. That was incorrect, which we found out later. In 2011, we had a miscarriage, which really messed with my mind, of course, mentally and physically. The things that happened after that are just really difficult to explain. The way that my body felt started getting worse and worse. I had horrible headaches. I had migraines. I had stress headaches. My blood pressure was up and down and up and down and up and down. And then found out that I had a thyroid issue, so I thought that that was the problem. The thyroid issue was from having the radiation. And also I had something called Hashimoto's, which is the most common way of someone having thyroid problems. It is not a rare autoimmune issue. It's just where your immune system attacks your thyroid and makes it go, inflamed or go up and down and up and down, and so you can't regulate your thyroid. So I had Hashimoto's plus the radiation. So then I started on thyroid medicine, but it still didn't help. My husband deployed in 2013 and was supposed to be gone. He had about 6 more months to go when in April of 2014, on April 20th, I had a stroke. I was taken to the hospital by my sister, and they did all these tests, the carotid artery test. They did a pulmonary test. EKG, they did an MRI, and they found out that I had a tumor right back here. The one that was on the skull here did not show up, but that was a concern that I had because my scar tissue I felt was growing, and I didn't think that that was right after so many years. I ended up going to Tulsa Cancer Institute, and my new oncologist agreed that they should send me back to Joplin, Missouri, to Dr. Larry and Dr. Kent McIntyre. And I had a surgery where they ended up removing the tumor here, and they actually did a scalp rotation where they had to debrief everything here, and they removed my ear. They removed my ear here, and then they moved my scalp from the back here to the side, and then I have a skin graft back here. Just let you see that real quick. That came off of my leg that covers the back of my head. I refer to this one here as ear holio, and the back of my head as ego, because it has like a grid where it is attached to kind of a mesh underneath it, and it makes it look like a waffle, so it's my ego. That way I can say leg on my ego if anybody's messing with my head. Anyway, so I have no ear here, and they had to completely hollow it out, so there's nothing in there but surgical matter. And then they removed that tumor, and they considered this to be clean margins. They could not get the tumor that was back here because it was wrapped around my jugular nerve, which is your swallow nerve, and it was next to my carotid. It was just too dangerous to get it. And so they did a Cyberknife. I had 5.5 treatments. A half treatment is because the machine broke down. I had 5.5 treatments of Cyberknife here, and then back in August, last month actually, I had another surgery where they reopened up my neck because all of these lymph nodes here and my throat were showing positive on a scan. They were lighting up. They did it, and they found out they were just abnormal. It was just side effects from all the radiation and everything that I've had. So that is kind of where I'm at as far as my cancer. A little bit about ACC. Adenoid Cystic Carcinoma is not funded by the American Cancer Society. We are a rare cancer. There is not considered to be a cure. And it is a cancer that's a glandular cancer, but it follows your nerves. And that is why there's a lot of nerve damage with people that have had it. And it does affect many more than I ever thought that it affected. I did not realize there were as many people that I have met that have this cancer, but it is still considered a rare cancer. You're more likely to be hit by lightning than you are to get this cancer. So we are a rare breed. There is not considered a cure. It is a cancer that often comes back. And the longer that it's dormant, the more people often get concerned because the worse your reoccurrence can be. It is a cancer that is vicious, and it has taken quite a few lives of people that I've come to care about over this last year that I've met them, and stories. I've heard a lot of stories of people that I would have loved to have had the opportunity to meet. So, if you want more information about adenoid cystic carcinoma, it's accoi.org is a great link, and that is to Adenoid Cystic Carcinoma Organization International, and also ACCRF, which is Adenoid Cystic Carcinoma Research Foundation. And so if you want more information, there you go. And if you happen to know somebody that has this cancer or has questions about cancer or treatments, I'll be happy to talk to them. So I look forward to hearing from you, and give me some feedback on this because this has taken me forever.